This program is a paid commercial announcement and in no way represents the views of WPHT or its management.
Talk Radio 1210 WPHT, WPHD-HD, WOGL-HD3 Philadelphia. Now, Health Watch, featuring Dr. Molly FANTASIA, the PhD doctor and founder of Innovative Medical Associates, with valuable information that could help you improve your quality of life. Now, Health Watch, and your host, John Damazzi.
Good morning and happy 4th of July weekend. Even though it's the 5th of July, it's still the weekend, and we're still celebrating. And we're celebrating that you're here with us as we give you another hour of information that'll help, hopefully, you and your family improve your quality of life. And we do that each and every week here, Health Watch, from 8 till 9 a.m. with the one and only Dr. Molly FANTASIA, the PhD doctor, executive director, and founder of Innovative Medical Associates, located in Marlton, New Jersey. We're going to talk about the who, what, when, where, and why of Innovative Medical and how it can help you. And if you want to call in, you have a question for Dr. Molly, 855-839-1210, 855-839-1210. Dr. Molly, your health does not know a holiday.
Good
correct?
Morning, John. Yes, I'm happy to be here live over the holiday weekend. Yeah, it's a good thing.
We decided,
why not do it?
Exactly,
we had a couple weeks where we were playing tapes. This is good to be back.
Okay, and 855-839-1210 is the number. I will say we're not wearing. Well, you're wearing red, white, and blue.
Of course I am.
We're in the spirit.
We're
right?
here.
We're
all Americans, right?
That's right.
Amen.
That's right. Let's talk about Innovative Medical Associates and what you do. And I mean, the other day I was in the chair, as I am every week, and I saw a lot of new faces, and many of them came from listening to the radio show.
Yes.
And just tell us what you do, or what is actually happening there.
Sure. Well, first of all, Innovative Medical Associates is a cooperative of healthcare providers who got together and actually I handpicked these people, and what we did was we realized we all had our own personal challenges and our own personal journey and in conventional medicine. So what I've decided to do is let them all work out of my facility, and that's fundamentally what it is. So we are a licensed primary care facility, but we have a little different mindset. Yes, if you need a prescription, Dr. Testa will write you a prescription. He's my medical director. If he sees fit and medically necessary, you're going to get a prescription. If you need blood tests, you get blood tests. So we can do anything any primary care facility can do. If you walk into some of these urgent cares, very similar in nature. But our philosophy is to use the least amount of the pharmaceutical to correct the challenge and improve your quality of life. And how do we do that? With hydration. We use hydration as a vehicle to deliver natural substances, vitamins, minerals, amino acids, things you would buy in the health food store. It's easy.
It sounds very simple, but
Oh no!
How many times people say to me, "What are you getting every week?"
Well, you're getting vitamin C
among
other things.
I know that.
But again, it's not quite so simple in that this is a medical hydration clinic. So therefore, we are not just wham bam, we slap you in the chair. No. We want to get some historical data. We want to know what it is that you're already on, the traditional meds that you're already on, and what it is that the patient wants to accomplish. Most people come to me, John, really in a situation where their quality of life has been impeded by either a condition, chronic condition, and or by some of the drugs that they're on, and they want to help reduce the drugs. Now, you know what I say. Do not cut your drugs yourself. Don't do it. You need medical assistance, and that's where we come in also. So we may be able to help you cut down on your statin drug. You know that yourself.
Yes. Yeah,
that's an easy one.
Yes.
It's an easy one. So yeah, we'll help you do that by delivering an IV that can help you lower your cholesterol, lower your blood pressure more naturally.
There has been confusion, and you've referred to it a couple of times, so I wanted to talk about it for a moment. When you say a spa,
no, we're not a spa.
You're a medical facility.
Correct.
All right. What's the difference? Because a lot of times people say, "Well, you get that treatment. Do you get massages and all that stuff?"
No, you don't. No, you don't. Clearly, I'll straighten that out. No, you don't. We are a facility, meaning that we run this as if it were a standalone facility, very similar to like if you went into one of the big named hospitals or healthcare systems and they have an outpatient department. That's what we are. We have a license, and the facility is my old name. The old name that we always used was Associates or Cherry Hill Clinic.
Right.
Been around for 20 some years. That's the facility that all of us work out of. And so the bottom line is our facility is very well sanitized through this corona. And how do we know this? Because we use the Department of Health guidelines. So we're not a spa, we're not a barber shop. We're using the Department of Health guidelines, meaning, I try to impose the mask on people and those who don't want to wear a mask. And there are patients of mine that have breathing problems, that kind of thing. Separate them from other folks, and also sanitize those rooms with both the fogger and the sprayer, and having a company go in. And I have an industrial hygienist, comes in, redoes this at least once a week, probably twice in the last 2 weeks.
And also we should mention that the difference with you and a spa, you have 2 medical doctors on staff.
Oh, yeah. Absolutely.
So,
yeah, Dr. Testa is my medical director.
Right. So
now, he does some spa-like treatments, and we'll talk about that at some point later. But generally, it is not a spa.
Right. Well, I just wanted to clear that up because sometimes people say, well, what do you get? You get a massage every week? Or is it?
No.
So I was like, no, I don't get a massage.
No. We can direct you somewhere if you need. I'll tell you, if you need a medical massage, meaning, like, say, some of my cancer patients needed a lymphatic massage. Well, I have other places that you can go to get that. But again, that's a medical massage. Little different.
Little different is right. But I wanted to also ask you to clarify this. When you get the hydration now, is this a weekly thing, twice a week, 3 times a week? And I've heard you tell some patients, I'll see you tomorrow or next.
Right.
So how does that work? How many times do you come?
Well, that works, John, based on what you're coming in for. Obviously, if you have stage 4 cancer and you're feeling pretty bad from the chemo or the radiation or whatever other kinds of treatment program that you're doing from your conventional oncologist, we may want you in twice a week. We may want you in 3 times a week. And some people stop their conventional treatment, and then we might want them in 3 or 4 times a week. It really depends on what's going on. Someone like you have stepped down from a cardiac situation and a hyperlipidemia situation, and we don't necessarily need to see you as often, but still once a week for your other conditions.
That's right.
So here we go. It depends on the comorbidities that the patient has, what makes the patient comfortable, what we feel is necessary, and we go from there.
Pretty much everybody gets hydration, but it's what's in the hydration.
Correct.
That
You hit
differentiates.
Absolutely.
Right?
And it's not just the colors of the bags.
Right.
That's the real key. And on an ongoing basis, I'm always looking at how do we improve our protocols. What new supplements, what new vitamins, what new minerals, what new amino acids, what new homeopathics can we deliver in order to effectuate the change we're looking for a patient. And my patients keep me on my toes in that regard. In other words, it's invariable that you may hit a plateau with a patient, but you want to look and say, is there anything else I can do? Can I give them a tincture? Can I give them something else that will help improve their quality of life?
Well, you did that. You did that to me this week. You mentioned that you
changed up your bag.
You changed because of a situation,
right? And
you made some changes,
right? Exactly.
So you're always pretty much doing
right.
that.
And I'm always consulting with my docs, and it's been a really good kind of situation in that, again, I'm lucky to have the physicians I have that are brave enough to look at the data to support these kinds of therapies.
All right, we're coming up on our first break of the morning. Our show is Health Watch every Sunday, 8 till 9, here on Talk Radio 1210 WPHT. Dr. Molly Fantasia is here. She is the PhD doctor and the executive director and founder of Innovative Medical Associates, Marlton, New Jersey. Questions for Dr. Molly? You have a medical challenge you want to run by her, or you just have a general question? Feel free to call in right now, 855-839-1210. I'm your host, John DeMasi. More of today's edition of Health Watch after these words. As always, when we're on the program here live on Health Watch, operators are standing by at Innovative Medical Associates, and they are there right now. 856-489-0505 is the number. You have a question, you want more information, Most importantly, if you want to make an appointment to sit down with Dr. Molly, that's what you do. You call them. You can call them right now, 856-489-0505, Innovative Medical Associates, Marlton, New Jersey. The website also with a lot of good information on it, including many of our previous radio shows. InnovativeMedicalAssociates.com. InnovativeMedicalAssociates.com is the website. And also want to remind you, if you miss any of today's show and you say, gee, I got up a little late, no problem. The show is repeated this afternoon from 4 to 5 here on Talk Radio 1210 WPHT. You see how accommodating we are? The number here in the studio, 855-839-1210, 855-839-1210, if you have a question or a thought for Dr. Molly here on Health Watch this morning. We always like to talk about, Dr. Molly, some current patients, some situations to help people understand what you do and how you can help people.
Sure.
This is an issue of pain management,
right,
which is always a problem.
Right.
So talk about this.
Sure.
Case that you have.
Yeah, this is interesting. As you said, you saw some new faces in the clinic this week, and this was one of them. This gentleman came to me. He was referred to me by a pain manager, very well-known pain management doc, right in Marlton as well, or Evesham. And actually, we've used him for our patients. And actually, I had a conversation and also have used him as a pain management doctor for me, in particular when I broke my arm originally. But nonetheless, he's really well known, and he sent me a patient this week. And this patient has something called RSD. Now, RSD stands for reflux sympathetic dystrophy, but that's an old term, and I'm an old girl. But it's now been changed to something called complex regional pain syndrome. So there's not a lot of data on how a patient gets this, but I can tell you it's an excruciating problem because it's pain that is so complex that when you touch a patient, if they have this, they feel pain. Putting on clothes, they feel pain. Lots of times people think they're going crazy. Sometimes, many times, it really develops because of an injury. And why that happens is the sympathetic nervous system. You know, God is a wonderful creator, and the sympathetic nervous system really manages the pain. And what it does is when you have an injury, like a trauma injury, it alerts the vessels, the blood vessels, to really shrink up so that you don't lose more blood on your way to the hospital or whatever. That's the whole point of it. But somehow in the mechanism, it stops working. And what happens then is it then contributes to this pain mechanism because what happens, it doesn't turn off, and therefore it really turns the nerves on. So what's happening is you're feeling the nerve tingling, that kind of thing, not just in the spot of the injury, but maybe in other spots as well, because it's a systemic kind of thing. So this patient has come to me, and part of the issue is the diagnosis initially is very hard to do. So a good pain management doctor is who's needed for this because it's really about the clinical symptomatology. There are some tests for it, including radiology tests and nerve conduction tests, that kind of thing. But in the end, it's really a kind of thing. This is the art of pain management. They then put a diagnosis on this based on the clinical symptoms. So from my perspective, the reason why the doc sent him to us was his quality of life has just gone downhill. He has a pain pump in, and how long the doc said, listen, I've done all I can for you. We can try to manage this in the long term with the pain pump, but you might need to see Dr. Molly and friends and see if there is something they can do to help, at least on an ongoing basis, improve your quality of life. Well, that's the perfect thing.
What will you be doing, or what's the plan?
It's an interesting thing because what we're doing is we're utilizing a subclinical dose. We're utilizing hydration, of course, and we're utilizing that with several amino acids, several injectable homeopathics, and we're also utilizing this with a subclinical clinical traditional medicine that is actually used to reverse overdoses for people who overdose on pain meds. Now, that sounds like an oxymoron, but I'm telling you, in the dosing and in the way we deliver this is very different than most places. And as a result, I did the research. I'm a member of a group that really promotes this particular drug. And we use it in such minute quantities along with the hydration. And the interesting thing about this patient is we called the next day to see how he was doing. And his wife said, guess what? He's doing a little better. And I said, I want to caution you, this isn't holy water. You got to come in next week and get another drip. And we may even have to reevaluate how often you get these drips. So you can see, John, I'm cautious about this. Everything we've given him is natural except for this one tincture. And I will tell you that already he saw a slight difference. Well, let me tell you, with people with this particular pain situation, a slight difference translates into a big difference.
Sure.
And the other thing that's interesting about this case is this particular condition affects more women than men. So when men get it, it's worse.
Well, men can't tolerate pain like women can,
well,
right?
yeah, I
As
guess
you've
that's
heard many
true.
times.
I guess that's true. So he was an interesting case that we got this week.
And so in the course of the treatment, is he going to have to be here for twice a week, 3 times a week? This
I'm
sounds
not
pretty.
sure yet.
This
I'm not
sounds
sure
pretty
yet.
serious,
That's
though, it
exactly
does.
right. I'm
Yeah.
not sure yet. It all depends on how well he tolerates the tincture. Now, that being said, I really want to caution people. We just don't, this is not holy water. You're
Right.
not going to get a drip and you're not going to walk on water. So the bottom line is we've got to do this carefully. We want to make sure that everything is clinically okay, and we got to get the qualitative feedback, because in this case, you know how you always ask me about the data, the
Yes,
data, the
yes.
data. In this case, what's important? It's not his blood work that's important. What's important is what he tells me week to week, because that tells me whether it's working or not.
And in the course of this treatment, is this the kind of situation where, and you said pain pump, and I'm thinking
That's bad.
that's bad,
Right.
So that's the kinds of things that led to this opioid crisis that we
Exactly,
had, correct?
exactly. But God bless the doc who's dealing with this. He knew that at this point he has to change up the pain meds so that the person doesn't become addicted to taking the opioids and rather goes into a pain pump. Now, again, you have to know how serious this is. Wouldn't it have been better for this guy to come to me earlier? Of course it would have.
Of course, yeah,
but
sure.
most people don't really realize that there are treatments out there that can improve your quality of life before your quality of life goes so downhill
That you can't come back from
that
it, right.
really makes it hard for us to do what we have to do.
What's your I guess diagnosis on this? Is
Well,
it look good, or?
here's my game plan. I certainly am not one, as you know, to give people false hope. I won't do that. But I do believe there's always hope. I do believe there's
Yeah.
always hope. And I think a lot's going to depend on how well he does and what he tells us in terms of his pain scale. And we do use a traditional pain scale, 1 to 10, 1 being not so much and 10 being very severe. So every week that pain scale will be managed along with some other things. But the bottom line is, if we can improve his quality of life anywhere from 10 to 50%, boy, that's a win.
Well, the fact of the matter is that the first treatment,
He had some
he
relief.
felt some relief, so
And the
you
key
have
is-
to be encouraged, I guess. By
I
that.
am encouraged, but the thing is, this is the kind of case that's in flux, and it really, really is going to depend on a lot of other parameters. So we'll see. We'll see.
When you hear a case like this, and you've had many cases here you've talked about on the show, it does make at least me be thankful that I have some challenges, but boy, I mean this case really sounds.
It's severe.
It's severe, yeah. So,
It's severe. And so, my job and I believe our clinic's calling, and all the physicians and healthcare providers in the place, the calling is to help him improve quality of life with not relying on opioids.
And that would be deadly.
Fabulous.
Yeah, it would be deadly if he was relying on
Yeah,
that.
I agree. I
Okay.
agree.
Coming up on a break here, our program is Health Watch. You'll hear us every Sunday from 8 till 9 live here on Talk Radio 1210 WPHT. Dr. Molly Fantasia is here. She is the PhD doctor and the executive director and founder of Innovative Medical Associates, Marlton, New Jersey. We are talking about some situations that Dr. Molly has come across our desk the last couple of weeks, and we're trying to explain to you as best we can some of the cases and how they can help people, and maybe you can relate to something like that. 855-839-1210 is the number here. Again, if you have a question or a medical challenge from Dr. Molly, and we always tell you this is a good time to call because what happens is just about every week we get to the end of the show and we have some calls, and we can't get to everybody at the end. So 855-839-1210. Dr. Molly Fantasia is here, and I'm your host, John DeMasi. We return. More of today's version of Health Watch after these words. And we're back here on Health Watch. Operator standing by right now at Innovative Medical Associates, 856-489-0505 is the number. 856-489-0505. Best thing you can do is call that number if you think you have a situation where perhaps Dr. Molly and her staff can help you. You make the appointment with Dr. Molly. The initial consultation is complimentary. And then you go from there. 856-489-0505, 856-489-0505. Innovative Medical Associates, Marlton, New Jersey. And you can also get some information on the website, innovativemedicalassociates.com, innovativemedicalassociates.com. Again, our show is Health Watch every Sunday, 8 till 9, Talk Radio 1210, WPHT. Our number here in the studio, 855-839-1210. Let's talk to Carl in Northern Liberties. Carl,
good morning. Carl.
You're on with Dr. Molly.
Good morning, Carl.
Good morning, Dr. Molly, and to your wonderful host. Dr. Molly, I'm facing a dilemma. Excuse me. I have a need to have a kidney stone removed or pulverized, whatever they claim they're going to do.
God
and I have a need to have a colonoscopy.
Okay.
I'm just almost petrified of the thought of going into a hospital these days.
You mean right now? Yeah.
Yeah, with the virus situation ramping up again. I'm just wondering your thoughts. If I had to pick one or the other, or what do you think?
Well, I tell you what I would. Well, first of all, is the colonoscopy a routine kind of thing that you're doing because your time is up and the doc had suggested that you get it done every so often? So are you at that point right now that this is needed in order for the follow-up?
Yes, but I'm also seeing blood in the feces.
That's different. So that's different. Okay. So I suspect that it's important that you go in for the colonoscopy. Now, won't your colonoscopy be in an outpatient setting?
Well, inside of the hospital
surgery
room.
Yeah.
And going home, assuming there are no complications.
Of course. Well, I will tell you that I am sure many of these surgery centers are following. In fact, all of them. I don't know on which side of the bridge you're going on, but I can tell you here in New Jersey and also just going by my facility, the guidelines are very strict. I think you have more of a chance of having a problem by not getting it done. Let's hope it's nothing. Let's hope it's just hemorrhoids or something that can be taken care of. Get it done. As far as the kidney stone is concerned, obviously you're going to have that taken care of at some point. Are you bleeding from in your urine as well? Are you bleeding in terms of your bowel movements and your urine, sir?
I don't believe I'm bleeding in the urine.
Okay, it's just uncomfortable, right? Pain?
Well, it's really not even uncomfortable.
Then guess what? Here's what I would do. If I were sitting in your spot, I'd probably get the colonoscopy first, get all cleared out, checked out, and maybe in 4 to 6 weeks, then go back to the urologist and talk about the kidney stone, because hopefully by that time we have all of this stuff, corona, under control. And in the interim period, I would do as much as I could by helping your immune system, okay? And then not necessarily high doses of vitamin C because of the kidney stone, but I would look at some other things like probiotics. As you know, I'm a big proponent of kidney probiotics as well. So, yes, that's what I would do. I would definitely have the colonoscopy.
Okay, what
Carl?
about the damage from the antibiotics? How do I guard against that?
the damage from the antibiotics? You're talking about probiotics or antibiotics that you're on for the kidney stone?
I know they're going to have to give me a doses of antibiotics for the surgery, I'm told.
Well, okay. I think that's easy. When you get out, you start doing probiotics. You start taking good probiotics. I think you'll be fine. After that, if you want to come in for an occasional immune booster kind of drip, that would be helpful. But again, I would definitely have the colonoscopy. I would definitely do it.
Okay, Carl.
Okay.
Good luck with that.
God bless you,
and thanks
sir.
for the call. We appreciate it.
Yeah, it's an interesting call.
Yeah.
Because
And also we should mention, and you were telling me, every week your nurse Barbara hands you the list of new regulations.
yes, yes.
So-
or updated regs.
regulations.
Yes.
So it's like this, and you're a facility.
Right.
You're a licensed medical facility. Imagine a hospital, their
Right.
regulations.
But the
so.
surgery centers, just imagine. Listen, I have a lot of physicians who are friends who belong to surgery centers, right? And we're just doing it. You got to have a good. Listen, I've got the best nurse in the world in Barbara.
Right.
Old time nurse, great nurse. And when I say old time, I don't mean aged. I mean old time in her thinking,
Yes.
meaning you continue to do infection control, not just when you have a problem, but all the time. You follow me? So that's a big difference. In other words, we have a nurse who didn't need the coronavirus to have us start looking at our infection control issues. You do it every day, not just during the coronavirus.
Right. I wanted to point that out so
Okay.
people understand.
Good.
855-839-1210 is our number here. We do like to talk here on the show about some current cases and new
Sure.
cases. And Dr. Molly, we're going to talk about another cancer patient. It's another serious case. Pancreatic cancer.
Pancreatic cancer. And here's an interesting thing. You know that I've been doing a lot of work in pancreatic cancer, and one of the amino acids that keeps coming up in any studies is alpha lipoic acid. That is something we use in the hydration for lots of our cancers, but in particular for the pancreatic cancer. But why I'm talking about this today, John, is because I'm using the same subclinical dose, different dosing now, subclinical though, of the drug that reverses opioid addiction, which I told you about, or opioid overdose, not the addiction. You got to work on that in your head. But the bottom line is, I'm talking about utilizing that particular tincture, and I saw a very interesting study. Granted, it was a small study. I think it had 10 to 15 people, but they were able to really extend life in these people by many months, 18, 24 months, and they were told to pack up their stuff and go home and just, get hospice, and that's it. Bottom line is, there's hope. There's hope with this. And you know what? The difference between being told to go home, you have 60 days, and finding out that you might have another 24 or 36 months in one area, guess what? That's a big deal.
Of course it is.
Because
Yeah.
you know why? There's always new traditional things going on. Dr. Molly is a very big proponent of looking at what's out there in terms of cancer therapies. Traditionally, you never know. There's new data coming out, new drugs are being tested, right? So guess what? That is a big plus. So there you go.
I just wanted to clarify, when you say, and you said this often, a subclinical dose.
It means lower.
The lowest possible, right?
Lower dose than what is conventionally
Okay.
used to treat why the drug was approved in the first place. So if a conventional dose of this is like 100 milligrams, we're using somewhere between 1.5 and 4.5, tiny doses.
Right.
But it's also in how we use this. In other words, the dosing alone is not always, it's always what I tell you, John. It's in the synergy of how to use it with the alpha lipoic and what form we're using. So believe me, we put a lot of thought into this.
It's the combination is really what you're saying.
It's the
right.
combination, and it's the form of how we give the drug.
And that when you say subclinical, that's exactly what you mean. I'm
Yes.
glad you clarified that, because
Yes.
I knew what it meant, but you actually gave us a number, so now we understand
Sure.
what you're talking
it's
about.
low dose.
But what's, again, I always like to kind of get a projection from you on this particular case.
Well,
What's the projection?
Well, I'm hoping that we can arrest this and he has a quality of life that exceeds what his conventional oncologist told him, and he's around for whatever trial gets out and cures it. But I can't cure.
No,
but if
right.
I can keep his quality of life up and his immune system up, and he can get into a clinical trial, they might be able to cure him.
And like you said, I mean, it's the difference between telling you to pack up and go home and 60 days, make your arrangements. But now you've got maybe 24 to 36 months.
You might have more than that.
Right.
If God, remember, I'm a believer that the big physician, God is the big and the ultimate physician. He decides when it's time to go.
We're coming up on our final break of the morning. We still have time for some calls. If you have a question for Dr. Molly or a particular medical challenge that you want to run by her, feel free to call in. Our number here, 855-839-1210, 855-839-1210. Our show is Health Watch every Sunday, 8 till 9. Here on Talk Radio 1210 WPHT. Dr. Molly Fantasia is here, and I'm your host, John DeMasi. We return. More of today's Health Watch after these words. Welcome back to Health Watch. As always, operators standing by at Innovative Medical Associates. And after we leave you at 9 o'clock this morning, they'll still be there, okay? So if you're a little late after we're off the air, it's okay. In fact, they'll be there all day. 856-489-0505 is the number. No holiday for the operators. 856-489-0505. Innovative Medical Associates, Marlton, New Jersey. As I've said before, if you want to call and make an appointment with Dr. Molly, the initial consultation is complimentary, and that's where you can get a lot of your information that you will need. 856-489-0505. The website, innovativemedicalassociates.com, innovativemedicalassociates.com. And don't forget, if you miss any of today's show, it is replayed this afternoon, 4 until 5. Health Watch replay here on Talk Radio 1210 WPHT. We do have a couple of minutes left of the show, and as I said, we still have time to take a call or two. If you want to jump in, 855-839-1210, our number here in the studio. Dr. Molly, we always like to talk about some of your patients, and this is a long-standing patient.
Right, our girl Sandy.
Right. What's her situation?
So Sandy has a lot of joint pain. She has osteoarthritis, rheumatoid arthritis. She's what I call a real challenge. And as you know, she was with me in the beginning of the early days of the clinic, then left us and recently came back. And she's in pretty tough shape when she came back. But what is interesting about Sandy is she's going to her primary and he's sending her to a rheumatologist who keeps doing PRP, which we do in our clinic, but of course we don't accept insurance for this, so she's getting it done somewhere else, and I'm all for that because I believe in the methodology. But it seems like she's overdoing it. Every time I turn around, in 4 weeks or so, she's getting another PRP in another joint. Well, guess what? I started looking at her, and she's telling me the pain is worse, and well, PRP does what? It stimulates inflammation. So if she has, let's say, head to toe inflammation, do you think that by continuing to stimulate this with the PRP might not be a good idea?
It's only making it worse, right?
It might make all the other joints worse, and it may even make systemically worse. So what happened is her doctor gives her prescription for certain blood work, and rather than having her go to the LabCorp as a courtesy, we can draw it in our place and send it to LabCorp because we are a full-service facility.
Right.
Okay. So we draw it, but my medical director added several other inflammation markers. What came back, and it's blowing me away, is her C-reactive protein cardiac. It is off the charts, which is telling me that she is at risk for cardiac issues. So now I have to change up her recipe to address the cardiac issues, the cardiac inflammation. But I believe this has been stimulated by the overuse of PRP, which is why it's very interesting to me, because we need to look at stem cells, PRP, and growth factors correctly, in that it's the same old story. More is not better in anything, right?
So this is interesting because
is a theory I have, right?
And I want to go with this for a moment. So you're saying that too much
of a good thing
is not good.
Right. Too much of anything is not good.
But how is it that this doctor is allowing that?
I really, I think, I don't know. I don't know the doctor. I don't know who she goes to, and I don't want to know.
Right.
I know her primary, and he's been a good man as far as I know, and he has an interest in integrative medicine. But I don't know about the specialist, and I really, it's not my place to know in her case because she's happy with him. But what I'm saying is now there's a new wrinkle in her treatment plan, and as far as I'm concerned, it's a theory. I rolled the theory by my two physicians who said, you think like a scientist. I said, yes, I do.
Well, that's what you are.
Right, cause and effect. And you know what? I said something's going on biochemically that's causing this. So her inflammation in terms of her laboratory markers are higher. So the idea is you want to use stem cells. You want to use PRP. Even me with my arm. Hey, it's over a year that I've had this, but I do this with a methodology. When I use stem cells and all, you'll know. I'm not doing it every week, and I have the ability to do that.
Yes, you do.
But how crazy would that be? Why not? That would just maybe start some other issues. So again, we know a lot about stem cells. I agree with it. I agree with platelet-rich plasma. I love all these things. But again, you want to use things in a judicious manner. That's why it's so important to really have a team look at you and say, well, maybe we should approach this a little differently. And that's what separates us from a spa.
I was just going to say, so now what is the game plan?
From my perspective, the next game plan, as far as I'm concerned, when I see her tomorrow, will be to show her these lab results and possibly attack the systemic inflammation that's going on around for the cardiac and also elsewhere in the body.
Do you stop the PRP for a while?
I would tell her to do that, yes. And I think, and I've got permission to tell her to do it from my medical staff. So you can be sure that they're going to get in it and tell her to stop it.
Because a lot of times people think that more is better.
Well,
right?
You know what the thing is, as I said a couple of weeks ago, stem cells also are not miracles. What you need to do is utilize everything in a sensible manner and get some advice. It's just like cutting your medication or doubling up your medication because you decided it's working. I want to work quicker, right?
Yes.
Don't do it,
Can't
folks.
do it, no.
Don't do it.
Can't do it.
Okay.
And so I guess the word is whatever you're doing, do it judiciously.
Correct.
Right.
You got to be smart. And I do think that even integrative modalities, you want to do it judiciously. I'm not crazy. We're not crazy over at Innovative. We know, for example, we just don't overdo something. When we talk about high dose vitamin C, we're making that dose appropriate for that particular patient, okay? We're not just hitting you with 500 milligrams of vitamin C and saying, oh, yeah, that's great. No, you got to look at the patient, look at their previous medical, look at the clinical data, and then move ahead.
All right, real quick, we have a couple of minutes left.
Yeah.
I know you wanted to talk about your athlete.
Oh,
How's he
yes, I
doing?
do want to talk about my athlete because that's a great case. He's doing very well. He had some surgery on his pitching arm. He's a young man. He's in college. He's probably going to be drafted into the majors. His healing is doing so well that his surgeon said, man, whatever you're doing, keep it up. He's actually throwing his ball, I think, in the 90s is the speed. Yeah, 90s, which is great, right? I'm told.
I think, what is he, 21 years old?
Not even. I think he's like 19.
Okay.
So that's happening, and I will tell you that his increased healing, actually, the time that it took from the surgery to the healing and getting back was due to the PT, physical therapy, and what we're doing in the clinic.
Can you elaborate a little bit?
Well, we're using amino acids, certain amino acids that are good for muscle, and we're also using vitamin C, which helps collagen, which helps the healing.
And so we're expecting...
I'm expecting him to be drafted and get a great box seat. That's what I'm expecting.
I know the young man. That's what I said.
Yeah.
I said, well, maybe the Phillies will
I hope
draft
so.
you.
I'm expecting to be in a box seat.
Right.
With his family.
You and me both.
All right. Maybe I'll take you, John. It's a date.
Okay.
Right.
And with that, as we kind of take a look at the clock, believe it or not, boy, the hour does go by quickly, doesn't it?
Great, John.
And with that, we put the wraps on another edition of Health Watch. Don't forget, if you missed any of today's show, we replay it this afternoon from 4 to 5 here on Talk Radio 1210 WPHT. And also want to mention, if you have a question or you want to talk to Dr. Molly, you want to make an appointment, 856-489-0505 is the number, 856-489-0505. Innovative Medical Associates, Marlton, New Jersey. The website, innovativemedicalassociates.com. For Dr. Molly Fantasia and everyone at Innovative Medical Associates, the lovely Linda, Barbara, Dee, fabulous Franny, and of course our nurses, Jess, Michelle, Crystal, our medical assistant, Kathy. I'm your host, John DeMasi. Thanks for listening. Have yourself a great week and a healthy one. We'll do it all over again next Sunday, Health Watch, 8 till 9 here on Talk Radio 1210 WPHT. You take care.